All right, welcome everyone. I will go ahead and get started. I show that it is 10 o'clock on my phone. I am Patrick Priest. I am the co-chair of MLAC for the management side, and it's my pleasure to welcome everyone here today to the August 1st, 2024 meeting. And we always start each meeting with an affirmation of the work that we're about to do, and I wanted to go ahead and read that. Hold it up here. I want to thank everyone for their time, effort, and participation in our work before us today. I want to recognize that it is very difficult and important work, and I appreciate and value the perspectives and professionalism that everyone brings here today. Thank you. Thank you for coming. And with that, I will turn it over to our administrator, Terry, to take a roll.
Okay, Sarah Merrick.
Here.
Scott Strickland. He texted me and said he's running late. Margaret Weddle is absent today. Lauren Bowling.
Here.
Sarah Duckwall.
Here.
Ryan Hearn.
Here.
Stacy Llewellyn. Said that wrong. She texted me and said she's running late too. Patrick Priest, co-chair Priest.
I am here.
And Kim Schlesinger. We do not have quorum.
Okay, since we don't have a quorum, we will not be able to act on our minutes later unless people show up.
Okay.
All right, we will start the agenda. The first thing is public comment. I open the floor to anyone who would like to make public comment. There are people behind me in the room. And online, I opened Zoom so I could see. I don't see any hands raised. We have somebody coming in.
Stacy.
Stacy Llewellyn has joined us. We've been waiting for you. All right,
I know, Terry. I
know.
I got it. You know what's gonna happen.
You're fine.
All right, we're just on to public comment, and there is none, so we will move forward. And the first item on the agenda is reviewing minutes from the June 1st meeting. We cannot act on them, but I guess I'll just pause and see if anybody had any comments, questions, or concerns about the minutes.
You did see the draft 4.
Yeah, no worries.
So,
Draft 4?
yeah,
Yeah.
because I messed up draft 3 and while we're here, I'll just say Baba has taken a rotation over at the board, and we have a new person that has joined us, Alicia Jennings, and she will be at the next meeting. So,
Great.
but Baba came to rescue me today, so thank you, Baba.
Really cool.
Yeah.
Yeah, good for her.
Yay.
All right, well, if we get a quorum later, we can go back to that agenda item. Otherwise, we will move forward. And the next item is back to you, Terry, for department updates.
Yes, and I will hand it over to Lauren at the board.
Thanks,
Lauren
Terry. Can
Eldridge.
everyone hear me okay?
Let's see. Do I
Am I
turn up the
on the
volume on the owl? Yeah, it's really light, Lauren. Let me
Okay.
see if it's the owl. Is it the
Kind of
volume on
sounds
the owl?
like it.
I don't know.
Just a sec. Let me see if I can figure this out.
Thank
Maybe
you.
if Sarah talks, we can hear her.
Harry, it's not the owl. She's soft for me as well.
Okay.
Oh, so it's
Yeah,
on
from
my
your
computer.
computer. Yeah.
All right.
Is it? Baba, help. Okay, just a second.
Yeah. Go to audio settings. Is that better?
Oh, it's right there. I actually figured it out.
I think we figured.
Sorry. Okay, Lauren, can you say something?
Hello?
Yeah, we can hear you very well.
I did it. Okay, go.
Okay.
Good to go. Thank you.
Wonderful. Much. Okay. Okay, so good morning, everyone. Thank you for having me today, co-chairs and members. So at the last meeting, you might remember I gave a brief update on some rulemaking taking place here at the board. So specifically, the board had proposed rule amendments regarding first, the appeal rights language required to be included in a carrier's denial of a worker's claim. And then second, the attorney fee limits for attorneys representing workers in disputed claim settlements and claim disposition agreements. So I have a quick update today on that rulemaking process. At its July 30th public meeting, the board voted to adopt the proposed rule amendments. So regarding the required appeal rights language for denials, the adopted amendments will become effective on November 1st, 2024. And you may recall that the goal of the amendments was really to simplify and improve the readability of that language so it would be more understandable to workers. Board staff conducted some research on the now adopted amendments and found that the amendments improve the readability of the rule by 5 grade levels. So taking the rule from an 11th grade level to now a 6th grade level. And then regarding the attorney fee limits for disputed claim settlements and claim disposition agreements, the now adopted amendments allow a worker's attorney to receive up to 25% of the entire proceeds of a settlement agreement, rather than being limited to 25% of the first $50,000 of proceeds and then 10% of any proceeds thereafter. And those amendments become effective on September 3rd, 2024. And that is all I have today, unless there are any questions for me.
Are there any questions? I'm glad we could hear it loud and clear, and
Thank you for your
thank you
help.
very much. Yeah. All right, well, if that's the end of that update, we can move on to the WCD updates from Ms. Watson.
Okay, so I have quite a few updates. The first one is I emailed out the MCO memorandum, and this comes from the last meeting that we had when the MCO, Matt gave the MCO update. So you should have a memorandum with Bulletin 247. So 247 is the document that explains MCOs are required to present quarterly on all the providers that they have. So it's a really big document and it has all the information.
Yeah.
But Bulletin 247 actually explains all the information that is in that document and how many providers there are, the geographic locations. So I apologize for the big long document, but they're also by Kaiser MCO, Majoris MCO, and Providence MCO. There are some numbers at the end of the document, and I just wanted to explain that quickly. 99 is for Washington providers, 97 is for Idaho providers, and 98 is for California providers. And those are on, we have certain injured workers that are, may live in those border areas. And so that's how that works. And then there's some resources on the bottom. The MCO geographic service area, it should be a map. Do I have the map? The spots here that shows the different areas.
This one right there?
Yep, that's the map. Yep, that shows the different areas. We have the certified MCO contact information that is there as well, along with the WCD MCO and enrollment webpage. So we wanted to make sure that we give you a lot of information, I apologize, but around the MCO information. And the last thing that I'll add is that healthcare right now, finding a provider is very challenging. Healthcare. And then you go to workers' comp providers. So it is very challenging to find providers right now. So anyway, I just wanted to make sure that you had this information. And again, it's a lot of information to digest. So if you review it and you have questions, please email me and I'd be happy to follow up with any of that information.
Okay.
So, okay, so that's the MCO update. The next update that I have is related to the Spanish website. We've finished the final translation pieces. They're in final edits and they are due back August 12th. And then that week we'll start the build. And that should take, a couple months to get done. But then we will have that completed. And this is something that you all did. This is just fabulous. I'm so happy that you brought this forward because it has really, this is going to be a wonderful project when we're done. So the build should start the week of August 12th. So great job, everybody. You did this. So come on. Yay!
Yeah.
You did this. Yay. All right.
Thank you, Terry.
So that's the Spanish website. The next thing I have is the calendar. Baba. Can you bring up the tentative calendar? I know some of you have been asking about the meetings for next year, and so you should all have a tentative calendar for next year. And so the co-chairs and I talked about this, what it should look like when session starts. Should we have quarterly meetings in person again? That kind of blew up this year with all the trainings. We didn't exactly meet like we said we were going to. So what are your thoughts about this? What do you think?
I like the way this year, the way we planned it, where we've had, quarterly in person and the rest
Okay.
hybrid. I thought it's nice to see everybody, but also have the flexibility.
Okay.
I agree.
Okay, so we can do that again. We can have them January, let's see, how did that work? January, April. Sorry, I don't have the calendar in front of me.
Okay. January, February, March would be quarter one.
Yeah,
April,
April,
May, June, quarter two.
July, and then October, I think is how it worked. Yeah.
Yeah.
So I can go ahead and do that, and then we can finalize this. Do you want to meet on the 2nd or the 9th of January? That was the other question I had.
I like the
This probably
ninth.
be better. Yeah, getting out of the holiday season.
Yeah, holiday
Yeah.
season coming back to
Okay.
work,
I
it's
might
gonna
have to
be,
be I might have to be online on the night, if it's the
Okay.
night.
And that's okay. We always have that option.
Yeah.
So,
great.
good morning, Scott.
Hi, Scott.
Yeah, welcome, Scott. I had a question about the schedule. I know that'll be when it's in session,
Yes.
during the session.
Mhm.
And so we had talked about, at one time, we had set aside weekly meetings, but we didn't always need them. And this is bi-weekly,
Yes.
which I think should be enough, but we may not always need them depending
Yes.
on what's going on. During session, it's busier in Salem.
It is.
And so will we have challenges of meeting in person during session?
Well, I think that was kind of the conversation we had is maybe we don't need to meet weekly, maybe bi-weekly is enough.
Yeah.
And so,
I think
and
that-
then just, we'll have them, and I put them all as hybrid meetings for an hour.
Okay.
Yeah, and then there may be a time where we have to, pull everybody together. There's pending legislation that we have to talk about. So just be aware of that since we don't have it on the schedule.
We're trying, I'm thinking back, and I felt like there were a couple of meetings that we did have to pull together this year, and we couldn't get everyone together. Were we thinking about just having a few more placeholder meetings for that situation? And then if we didn't meet them, great, we could just cancel them. But that way, it's easier to have something on the calendar for everybody and cancel rather than trying to pull together at the last minute. Just food for thought.
I think that's what the
And is
bi-weekly
that enough
meetings.
time?
Yeah.
Okay, I seem to remember a couple weeklies or something where it felt like it was a little more frequent.
Patrick,
Sarah,
I remember we were gonna go to weekly as placeholders and then cancel them as necessary during
That's
session.
what I thought, Sarah.
Yeah. Yeah, so we did talk about that, scheduling weekly, but then we didn't know that we thought it might be overkill, because I think that's what we did last year, and then we ended up canceling all of them.
The thought that I had on it is I know in a long session, typically there's more work that we have to do, but it isn't on as tight a timeline. So part of the thought that I had is if we had the bi-weekly, that provides a little more time for stakeholder engagement and working through some things instead of just hashing it out in front of us, that there can be a little more kind of collaboration in the interim between the meetings. But I do recognize it's very hard to schedule meetings with everybody. In the thick of things, you know, if we have, oh, well, next week we need to schedule a meeting, what's the availability, that's not very easy. So I think we were open to both. I think we thought that biweekly, especially with the long session, would maybe be a better idea. Especially since we've had all of the great work that DCBS and others have had with doing the outreach with stakeholders saying, look, this is the preparation that we want. Here are the kind of questions we're going to ask. Can you make sure that you have your ducks in a row when you come to us to see? But again, I'm not, you know, very aggressively committed to this idea. That was just kind of the thought process and discussion that we had had.
I'll let you guys take the lead on this. I haven't been a part of a big session yet, so I don't know, you know, what to expect as far as workflow goes. I'm comfortable with the bi-weekly. I think that makes sense, but if we feel like we need to have those weekly just to place that hold, I get it as well. So I'm flexible, whatever the group decides.
I think it'd be smart not to placeholders before chamber deadlines, though, just to make sure we have something as those approach.
And that's the thing, I'm waiting for that calendar to come out. So I can't do anything till the end of September until I get the calendar. So that's why I thought if we have this, then we have an idea, and then I can get a final schedule. So this will be drafted until, I think it's the interim days in September when I'll get that calendar, so.
That's plenty of time.
Okay,
yeah.
That's okay.
Yeah, no, I'm just trying to avoid the
Yeah,
week before
last minute.
scrambling. We had that a little bit this year. So
Yeah,
I'm
absolutely.
just thinking if we need a few placeholders, that's great.
Totally.
Cancel them, wonderful. Everyone gets an hour or two back to their day.
Terry?
Sounds great.
As well, I remember us having a preview toward the end of January, a session preview meeting. Is that going to be scheduled as well?
We can do that. That sounds great. Yeah. Let's see, I'm thinking session starts the day after Martin Luther King Day this year in January. So maybe we should do that in January.
Or if the agenda's light on the 9th, move it so we have a session preview meeting.
On January 9th. Okay. We can definitely do that. And, you know, we're hearing things about, you know, it's all rumor at this point, but if something is, if something definitely is going to affect workers' comp, we're making sure that, you know, we're reminding them, you need to come to MLAC and look at the webpage. Here's the process. So
Great.
Most stakeholders are very aware of the process. So.
And then
Okay.
one final comment on the July meeting is canceled, but that would be our in-person schedule. Would that shift to August?
I just put that on the calendar since we did it this year. So yes, I thought that would be good.
Thank you.
Absolutely. Let me write that down so I don't forget. Okay, gotcha. Okay, let's see. What is the other thing I needed to share? We have a quorum.
Okay, yes, we
Yeah.
can go back to that if you're done with you. We will go back on our agenda to review the minutes. And we already did open it up for discussion. There was none before you arrived, Scott, but you make a quorum. So I would ask you if you had any comments, minutes or concerns.
Didn't have any. No.
Okay.
Myself in this draft.
So then I would seek a motion to approve the minutes of the June 1st, 2024 meeting.
So moved.
From Stacy, second.
Second.
From Sarah Merrick. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed, the same sign. It carries unanimously. Thank you. All right. Any other updates, Terry?
I do, but I'm kind of going to save that to the end. Is Barb Anderson on and ready to go, Bob? Oh, there she is. Okay, I'd like to hand it over to Barb, if that's okay.
Yes, of course. Ms. Anderson, if you don't mind giving your update now?
Nope, that's fine. Good morning, everybody. I think Baba, will you guys be sharing the screen to play the video? Just a quick update, as discussed previously, we went ahead and are starting to do some just very short training videos for workers. And the first one we finished was the how to fill out an 801. It's in English right now, but it's finalized and it's being you know what word I'm looking for. It's being changed over to Spanish. Anyway, right now this video is only available on YouTube. We don't have it on our website yet, but that's only because our website needs an entire overhaul because it's really not user friendly. And I think I mentioned that before. So we're working on getting rules on our webpage and getting a bit more OSHA stuff on there, just redoing a whole bunch of stuff on there. So we haven't added the training video yet, but it will be. So right now it's accessible through YouTube. So if you would like the link, we'd be happy to send it out. We've been sending it out to workers recently, and I think it's super helpful. So here is the finalized version if Baba wants to go ahead and play it.
Sorry, give me a second.
Take your time.
While we're waiting for that, I did skip over, just for the record, that this is on the agenda, the Ombuds Office for Oregon Workers 801 video.
Yes.
So that we've been waiting for.
One of those little popcorn carts with all the videos that we watch.
Yeah.
Do you have it, Baba?
Yeah, but it's not showing up under my shared tabs. I don't know why.
I think I have it. I don't know if I should touch anything though. Me and computers. See. I have it in my Teams chat.
I would offer to share it, but I don't know if it would work for me.
Do you want to have her do it, Baba?
I think so, if she can.
Okay, can you share it and let's try it that
See what
way, Barb.
Okay, hold on one second. Oops. Ooh, pause. Okay. Let's see if I can. Hold on, I've not done a share screen from this before. Oh, here we go. Let's see which. This one. Okay, can you see my screen? Black?
Yeah,
There we go.
great.
Okay.
Perfect.
Hopefully you'll be able to hear it as well.
Yeah, we don't hear anything yet.
Nothing yet.
Oh, well, the sound was going, so that's what I was worried about, that you wouldn't be able to hear it.
I think I can do it now. So.
Oh, okay.
Okay, Baba's gonna do it now?
You got it, Baba?
Yes, I think so. Hopefully.
Here we go.
Nice.
I'm working.
See.
Does that have to come from my computer, Baba?
Give me a second.
Okay.
It's coming from my computer.
Oh. I'm so sorry.
No, don't. You're okay.
I mean, can you guys hear it?
No. Oh, can you hear it?
I can hear it, but I'm really
Well,
close to
okay,
the
now-
computer.
Baba, why don't you send it to me and because it's my computer that it's coming from.
It's up to it.
Yeah. Let's see. Oops, I'm not logged into nothing. at it. I'm just. Oops. Now I just need to share the screen.
I can see it from here.
Yeah.
I'll tell you how it is. Yeah.
Pardon?
There we go.
Did you hear it? And let's see, do people want to hear it?
Welcome to the Oregon Workers Compensation Division's Form 801 video.
Ask them if they can hear it.
Can you hear it online? You can?
You can't hear it properly then.
Oh, Barb says she's hearing it online.
Sarah, Barbara said yes.
Oh, okay.
Well, we can hear it.
Yeah.
For now.
In the
Right.
room?
We
Yeah.
can hear it.
Yeah.
This
Okay.
video was created by the Oregon Department of Consumer and Business Services, Ombuds Office for Oregon Workers. We created this video to help guide you through how to complete the worker portion of Form 801, Report of Job Injury or Illness. To make a claim for a work-related injury or illness, you will need to fill out the worker portion of Form 801 and give it to your employer. If you do not intend to file a workers' compensation claim with the insurance company, do not sign the signature line. After you fill out and hand in the form, your employer should give you a copy of the form for your records. The first step is to fill in the date your injury or illness occurred. This gets a little trickier to do in cases of injuries or illnesses that happen over time with no clear start date. In those cases, you may want to use the date of your diagnosis or the last date you worked if you are no longer employed by the employer at injury. Next, you will want to fill in the date you left work due to the injury or illness. In many cases, this is the same as the date of injury. However, if you did not miss time from work, you should leave this section blank. You will then fill in the time you began work on the date of your injury. This is the time you started your shift. In the next box, you will indicate your regularly scheduled days off. If you have days off that change week to week, don't check any boxes or write varied. Ignore this next section. It is only used by the Workers' Compensation Division. You will next fill in the time your injury or illness occurred. Leave this section blank in cases of occupational disease or if you are unsure of the time the injury or illness happened. Next, you will fill in the time you left work on the date of injury. Again, leave this section blank in cases of occupational disease or if you are unsure of the time the injury or illness happened. In the next box, you will want to make a check mark if you have more than one job. This box is very important and a way to notify the insurer or service company that there may be supplemental disability. In other words, lost wages for a job or jobs other than a job at injury. Next, you will answer the question, what is your illness or injury? Make sure your answer includes the body part and that you check the box indicating which side of the body is the injury. For example, if your injury is a sprained right foot, you would write sprained right foot in the space provided below and check the box indicating the right side of the body. Next, you will explain what caused your injury or illness and what you were doing at the time. Make sure you include any tools, equipment, vehicles, machinery, etc. that were involved in the injury. A perfect example of the level of detail needed is provided on the form. The worker fell 10 feet when climbing an extension ladder while carrying a 40-pound box of roofing materials. This next section is where you put your personal information, such as your legal name, language preference, birth date, gender, mailing address, home phone, work phone, and occupation. In the next box, list any names of witnesses to your injury or illness, if any. If you have health insurance, you will provide the name and number of the insurance company in this box. Leave this area blank if you do not have health insurance. In the next box, provide the name and address of a hospital or clinic you were treated at for your injury or illness. Leave this area blank if you have not yet sought medical treatment. You will then answer the next two questions. Were you hospitalized overnight? Were you treated in the emergency room? By checking the appropriate boxes, yes or no. Please read this next section carefully before signing the form. The section says, By my signature, I am making a claim for workers' compensation benefits. The above information is true to the best of my knowledge and belief. I authorize healthcare providers and other custodians of claim records to release relevant medical records to the workers' compensation insurer, self-insured employer, claim administrator, and the Oregon Department of Consumer and Business Services. Notice, relevant medical records include records of prior treatment for the same conditions or of the injuries to the same area of the body. A HIPAA authorization is not required. Release of HIV/AIDS records, certain drug and alcohol treatment records, and other records protected by state and federal law require separate authorization. I understand I have the right to see a healthcare provider of my choice, subject to certain restrictions under Oregon Revised Statute 656-260 and Oregon Revised Statute 656-325. Once you have read the above statement, it is time to sign, print, and date the form. Once you have completed the worker portion of Form 801, return it to your employer. The employer will then fill out the employer portion of the form and will have up to 5 days to report the claim. If your employer is no longer in business, you are no longer employed with them, or the employer refuses to file the claim, please contact the Ombuds Office for Oregon Workers. We can help you get your claim filed. Call toll-free 800-927-1271 or email oow.questions@dcbs.oregon.gov.
Looks great.
Good job.
I assume you all heard my voice enough, so I'm done talking.
Yeah.
That was really nice. Very well put together.
Thank you. Are there any concerns with it or any other feedback?
So for gender listing, I don't know specifics for state of Oregon requirements. Do we have other options for folks that identify differently, or is that required for identification purposes?
Is there someone from, I'm pretty sure that's required right now, I believe. Terry, do you know?
Matt's coming up to address that because I know that we're going through changing the.
That's what I was thinking. Okay.
Good morning, Matt West, interim administrator of the Workers' Comp Division. So there was a Court of Appeals case in, I think, 2020 or 2021 that said in the state of Oregon, a person can legally change their gender to non-binary. We're in the process of updating our claim system to accept those other values. It's an older system, only accepts male, female right now. So we're working on updating that. Once our claim system's updated, we plan on having the discussion with the industry and updating the 801 to accept those other values. But if somebody they can put that on the form right now, and we would just have to manually override something in our system. So there's been work going on for the last year on it, and we're continuing to work on it. So also good plug for our modernization program is a system that we can adapt. So any questions or anything that?
Yeah, so I guess just a person can put as they identify, or could they leave it blank potentially if they don't?
Yes.
In either situation?
Yeah, they can currently, and we wouldn't reject the form.
Okay, so, perfect. I just want clarification because I know a lot of times with those systems, and I know we've talked with Foley about them modernizing all of their systems, that there are requirements that you need the technical capacity before you can then change that. So I just wanted to make sure that there were options and that wouldn't cause a refusal. But otherwise, I think it's a great video. I think there's tons of good resources, and I did really like how it moved through section by section so that especially somebody with language barrier or something like that can really methodically make sure that they get everything filled out properly. And I always think we have a lot of members that speak languages other than English, and they have their high school child that will sit and help them through paperwork. And so it makes it really accessible for folks in those situations. And I really appreciate that work. So
yeah, that's great. It's the first time I've seen the video too. So Barb and her team did an excellent job. And I was making notes, making sure our folks had, access to it, because we have a call center, and make sure they can get it out to workers as well. So, thank you.
I did send it over to BCU, just so you know, Matt.
Oh, thank you. I can cross my note off there.
So I just wanted to echo that it's a great video, and I really thought it was very informative and just what we needed for filling out the form. I think, Scott, you had a great question about something about, not about the video, but about the form itself. I had a question about the form itself as well. Is paper required, or is there an electronic way to submit this information? Because it's just seems like in this modern day, there should be a website where you enter that in rather than having to write it on a piece of paper.
Right. Paper is not required. And, the 801 goes to insurance carriers. So, if they have an electronic version that they accept, I know we have folks from SAFE on the room, they could probably talk about ways that they accept the 801. We provide the form, and the required fields, but there's not a requirement that it's sent to the insurer on paper.
How about the signature? There's like a legal statement, and so they have to sign it. So an electronic acceptance of that is fine too?
Yeah, I believe so.
Yeah. At my organization, we have a nurse line where people call in, and then the nurse line fills out the stuff.
Yeah.
And I think that they mail them a form, and then they sign it and send it on. I think. And so that was the purpose for my question.
Yeah, and at Roseburg here, we can do it either way. We just provide them the form either electronically or in paper form, and however they submit it. Typically, though, even if it is in writing, that's scanned and then sent over to our third-party administrator for handling. So it's in that electronic, format already, and then TPA then sends it off to the department. So,
Great. Thank you.
Barb, is there a plan to do a similar video for the employer portion? Just thinking of some of those small employers navigating that the first time, it might be helpful, especially when calculating the average wage and that type of thing. Is there a plan to do that as well at some point?
That hasn't been on our list of plans. We're focusing on the worker piece of it, but I think that's a really good suggestion. That might be something maybe Caitlin from small business and I could talk about.
Great.
Yeah, I have a meeting with Caitlin tomorrow. I'll put it on my list and let her know that MLAC suggested that and show her Barb's video. So.
Yeah.
And we work with the same communications department, so probably make that happen.
I guess I got a question. So at the end there, it mentions 5 days for the employer to turn it in. I guess I've always been under the impression it was 3 days, and maybe I just set that for myself, so I'm always on time. but I just wanted to see if there was clarification there. Is it 5 or 3? I personally believe it's 3.
Yeah, it's 5 days
okay,
from
great.
the employer's date of
Yeah,
knowledge.
yeah.
There's the 3-day wait, maybe for like time that's related to time loss.
Yeah,
Maybe that's where there's
that's
the
probably why.
confusion. Yeah. We like to throw just random dates.
Right.
You might just be an overachiever.
There you go.
Yeah, that's
Might
a good
just be-
internal, like, hey, we want to get this to. And I think somebody was Dave Walkie on? I thought somebody was saying something.
He has his hand up.
Okay.
Okay.
Dave
We'll
Wilkie.
recognize Dave Walkie to make a comment.
Co-chairs, members of the committee, Dave Walkie, former small business ombudsman. Caitlin is on the road today, so unfortunately, she can't participate in today's meeting. But as I was watching that video, I said, well, that's a great idea. I think we could probably put something together to address the employer portion of the 801. So I definitely made a note of that, so I can discuss this with Caitlin and see if we can go forward with a project that would address that. Thank you.
Thank you.
All right.
Thank you. Thank you very much.
Thank you.
Great video and great discussion. So thanks everyone on the team and Barbara in particular for bringing this forward. All right. So the next item on our agenda is a work plan update. And I know Terry Watson has an update on one of the items that's been on there for a long time, the NIOSH Cancer Presumption Report.
Yes, well, I just wanted to update everybody. Sarah, Merrick, and I did meet last week. We finally got around to meeting, and there just isn't anything to update folks on. There is the registry. They're trying to provide outreach so firefighters will register, but and what was really interesting is Sarah and I met and we talked about this, but right afterwards, I had a phone call from Carl Koenig, who is the lobbyist for the state firefighters. And he said the exact same thing. There's just nothing to report. So with everybody's permission, we just like to leave this on the work plan until something comes forward. But in the meantime, there's not really much we can do until then. So if that works for everybody, that's what we'd like to do. Just leave it there. So, okay. All right.
All right, I see nodding heads and I see Sarah. Sarah, I have to look over to the side to see if you have comments or not. So I don't see any.
I have no comment.
All right.
And let's see, thank you for that one. And then on the agenda, it just is now then opened up to see if there are any other.
So I just sent out the work plan update, just for everybody to review after the last meeting. I wanted to make sure that I covered what everybody was talking about with the work plan and make sure I didn't miss anything. We had quite a bit of discussion around the work plan last time. So if I covered everything,
Does anybody have any comments?
I have one, and I haven't, I apologize for not reviewing it thoroughly, but I was reading in the minutes a comment from Scott about adding a different perspective. Did that get translated or added to our work plan? If you go.
Yes, I do have the regulatory update under educational sessions and educational topics, educational sessions on topics. I have regulatory tour start to finish. It would be on page 2, basically, I guess would be what it would be called.
Perfect, thank you.
All right, good question. All right.
So if everybody's good with the work plan, I just have one final thing I'd like to share with everybody.
Okay.
And that is the mental health claims data for the training that we're going to have today. The data, folks, if you look at the mental health claims document, there is a third page now. And that third page is would be all claims. At the last meeting, you asked about all claims related to mental health claims. So they ran 5 years worth of data, and so you can see all the claims versus the mental health claim. And again, this is accepted disabling claims that you're looking at. So as you can see, it's quite different compared to mental health accepted disabling claims. So I just wanted to point that out and see if there were any questions.
Harry, no questions, just a comment that mental health claims are still a very small portion, even in first responders, to all claims.
Yes. And then the last piece that I wanted to share with you was the workers' compensation claims characteristics. There were some questions around cost of claims and where claims, what's getting injured, those kind of things. And so workers' compensation every year has this claims characteristics. And I thought this was the best way to share some of that information. Unfortunately, that 2023 calendar year will not come out until the fall. So this is the 2022 claims characteristics. So it does have a lot of information in it. It tells you the most common claims, how people are getting hurt, the event, the source. The one thing you did ask about that it doesn't really point out is the cost of the claims. If you look on the last page, there's injury disease facts for Oregon 2022. So it does say, the median weekly wage, some, they have, oh, I apologize. On the front page, it says the oldest worker and the youngest worker. but finding that information sometimes is challenging. So I just wanted to make sure that you had a little more information before this mental health training this afternoon. So.
Terry, with the new one coming out in the fall, will you tickle to send that to us as well?
I will.
I found this very useful. Thank you.
I assume this data is gathered by TPAs or fed from TPAs to the department?
The data
No worries.
Our system.
Our system.
I
But
know.
OSHA, I mean, there's OSHA.
Yeah, it comes from several different places, but I think the insurer reports the information and then our data folks upstairs, but it's like, it comes from OSHA, it comes from several different places,
I just know from working with TPAs in the past, right? A lot of that data is driven by the claims adjuster getting that data in there and putting it in. Sometimes I worry about the accuracy of the data. I'm not saying that this isn't, but just want to throw that out there and make that aware.
Well, and that's what's gonna be so great, again, to plug our modernization, is that right now, a lot of it is human put in instead of, and not that that's bad.
No, yeah.
But it'll be modernized and.
Perfect.
Yeah.
I'm sure on a whole, it's great data, but
Yeah.
I'm very aware of that.
Kind of riffing off that question, is there any kind of degree of certainty that this is capturing the entirety of it? I know that we had some discussions, it was 2 sessions ago at this point, about reporting and like on-site medical treatment, when they have a nurse's station and then they don't report it because they bandage the person up and then send them on their way.
It doesn't capture that.
Or bad actors or any of that kind of stuff. And I don't know if there's a way, not being an economist, I know that they are very clever about how to capture data or at least extrapolate, we're 90% sure that this is kind of a holistic capturing of the information out there. But if there's any way to kind of predict how all-inclusive this is, I know, people that are bad actors, they're going to lie, they're going to do whatever they're going to do, but I wasn't sure if there was a way to capture that or have any kind of discussion of that. Or
Well, again, the data that we have is only accepted disabling claims. So what you're talking about, somebody that, and you and I have known lots of trade workers that go in and bandage up their finger and go back to work.
Right.
And in the forest product,
Yeah.
I have brothers that are loggers, I'm not going to go.
Absolutely.
Yeah. So anyway, those aren't reported. Or, anyway.
Yeah.
Just want to go down that road. Oh, sorry.
I'll just add, like Terry mentioned, this is just accepted disabling claims, not non-disabling or medical only claims that are accepted aren't reported to us at this time, which are the bulk of claims. And again, through modernization, when we get there and have electronic claims reporting, the goal is to have all claims reported, and then we'll have at that point in time more comprehensive data. I know that was a big topic during COVID, and every time we talk about data, we have these caveats of things that aren't included. But yes, this is accepted disabling, and it's reported to the division by insurers or claims processors. And then, like Terry mentioned, we have our current state. We have a team of claims coders that key in the codes for the different occupations and body parts that are injured and mechanism of injury. So future state, that'll be reported electronically. So.
No, and that's exactly what I was thinking is when we were going through all the COVID data and everything, and there was the question of the number of people who weren't filing claims because they didn't know they could, the number of people who weren't filing claims, because they're, I'm going to walk it off or whatever, that kind of situation. The number of people who were attempting to file claims, and then, employers would either intimidate them or throw the claim away or not, all of the bad actor kind of stuff that happens. So just all of that, it was kind of interesting to try and pull the data. And I know you can't really capture something that's just not reported or underground economy stuff, and all of that's difficult. But I was just curious if there was any way to kind of figure out how much of that there likely was, and if that makes up 2% or 5% or 50% of the data that we would be likely to see. So
yeah, and it's a good question we can pose to our research team to see if they have any thoughts on that. Yeah.
It's interesting to see the severity, with the disabling claims going, from 2019, it was 1.12% or 0.2. And now it's 2021 was 1.27. We saw it jump to 1.17, 1.27, drop down to 1.26. But it's interesting that it jumped that much with the pandemic. And just, curious if that trend's going to continue or if we're going to see that start to come back down. For many years, the average range was right at 1.10. It went from 1.08 to 1.12 between 2013 and 2019. It was kind of the number there, and then that jump with the pandemic.
Yeah.
Harry? Can I ask Terry a question?
Yes.
Terry, will all this be updated on the MLAC website, or is it there currently?
It's not there. We always post things after the MLAC meeting, so it will all be available on the MLAC website after the meeting.
Great. Thank you.
Yeah, this was a great report, so thank you very much for bringing this forward.
Absolutely.
And I guess with that, there is no other business to be brought before our group.
We need to talk about canceling the September meeting.
Okay.
So you wanted to?
Well, so we have a meeting on the schedule for September. And let's see, I don't have the date in front of me.
September 5th.
September 5th. Is there anyone here that has a compelling reason to meet? Otherwise, we will cancel it.
Just seeing all you guys.
That's it. Miss you, but
All right. Sounds like there's consensus. Do we need a vote?
No. So our next meeting will be the offsite meeting in the Dalles. And so I just saw Sabrina walk in. And so we're going to close the public meeting here at 11. And Sabrina is going to do the offsite training for the people that need to travel and do per diem. So this is the first time we did this. So it'll be fun. And Sarah's going to stay on and we're going to go through that training. So because I know you guys do the TEDS travel for mileage, but this is a little bit different. So with that, we can go ahead and close the public meeting whenever you're ready, Coach.
Okay. Is there any reason to not adjourn the meeting? Let me go ahead. Well, I will officially adjourn this public meeting and move into a work session that will start after a 5-minute break.
Perfect.
Okay.
Okay,
Thank you, everyone.
Thank you.
Right.
I like your gavel.
Yeah.
I had that.
Hey, Bobby, if they don't hang up, can you, but at 11, can you, gotcha, thank you. Yeah. I didn't want to say that. Yeah. And you guys, there's fruit and treats back there.